Welcome back. Well, yes, indeed, we'll be examining the health sector in the face of some of these challenges that we're facing, not just here, globally as well. So we've got Dr. Betta Edu, Commissioner for Health, Cross River State, and she's the chairman, Commissioners for Health Forum, joining us on our studios in Abuja. We also do have Professor Oluwole Atoyebi, who is the former president of Nigeria Medical Association and former provost, College of Medicine, University of Lagos. Thank you both for joining us today on the program. Well, Dr. Betta, let me start with you on this matter. Well, broadly speaking, first and foremost, I mean, the report did highlight at least some sort of the kind of challenges our health sector is facing, but being there in the state yourself, if you could extrapolate, how challenging, if you could give us that picture, does our health sector face in terms of our capacity? Where are we with all of this?
Thank you very much, and thank you for having me this morning. As we start the new year, I think this is a very, very important topic which we need to discuss to shape reforms in the health system presently. Really, to be very honest, the Nigerian health system is very fragile and needs to become more resilient to be able to deliver quality healthcare services to everyone in Nigeria. Of course, there should be that universal access to healthcare. In all honesty, COVID-19 has actually opened up the fragility of our health system. And of course, it has become a leveler. Before this time, if people are sick, if people have issues and they belong to the elite class, there's that option to fly to another country in the Western world or somewhere else where the health system is more developed to see that they get better health care. But we are faced with a situation where there's no going out, there's no going back. So once you're sick, you have to rely on the same fragile health system. And so this is a call for all of us to fix the health system. Really, a couple of challenges exist, beginning with the health workers, like you have shown. A lot of people are leaving Nigeria to find greener pastures outside the country. And we as a country must look for how best to keep our health workers, doctors, nurses, lab scientists, pharmacists, and the rest of it back in our country, providing incentives and, of course, doing our very best to see that they are highly motivated. We should also bring up a scheme that can be able to pick up all health workers coming out of institutions and try to backstop. For the meantime, you know, states are stressed right now and some of them unable to pay salaries. We should be able to bring states out and try to bring out these health workers and try to put them on a scheme and then send them into the states to go and work, especially during this pandemic period. Of course, beyond the health workers, we have issues around infrastructure, the primary health facilities that needs to be fixed, secondary facilities in states, and of course the teaching hospitals that should be part of the response to the health system. They too are largely affected, and indeed every state at this point in time would require at least a specialist hospital that comes with a molecular lab and also, of course, a permanent isolation center that would not just respond to COVID-19 pandemic, but should be able to also respond to other issues, including the Lassa fever, which you have also stated earlier on in your report, and several other diseases. Whatever pandemic, whatever epidemic it is, we should be able to build a health system that can appropriately respond to this. So for us, really, this year, we need to do things a bit different. We have tried, but we need to step up our games as we go into year 2021 and ensure that our people can have access to quality healthcare that they truly deserve.
All right, Professor Atoyebi, from your perspective, I mean, yes, COVID did take a lot of countries, if not all, by surprise. The challenges were huge, but they've done different things since then. From our own standpoint here, are you encouraged by the kind of steps you've seen us take? What should we be doing at this point in time? Prof, can you actually hear me?
Hello, Chamberlain.
Okay, good morning.
I can hear you.
All right, go ahead
Good
then.
morning. Yeah, I didn't get your question now.
Okay, well, what I'm asking is, COVID did take the world by surprise, and health sectors, institutions were challenged by COVID. But from our own perspective here, are you encouraged by what you've seen us do to improve our capacity in the health sector? What do you think we should be doing?
Well, I do not believe we have done enough, although we rose up to the challenge and a number of things were put in place. Luckily, we had experience with Ebola and we were able to contain it. And this time around, a lot of things have been done, but we still need to do more because the COVID pandemic is still with us. The second wave is actually right here now. And in the 2021 budget, there's even no special provision made for COVID or any other pandemic. I mean, from experience, we should know that we don't wait until something like this comes up before we put things in place. And isolation centers were being closed up even before the second wave, and then suddenly we have to rush back to do it. The emergency preparedness is a very important aspect of healthcare, and this must be taken more seriously than we have done so far. And it was good that both public and private sectors came into it to help during this pandemic. But then we should prepare better for the future because we realized that the infrastructural decay over time confronted us, and that we had to be having some makeshift arrangement. This should not be. We should be better prepared. And as has been mentioned by the Honorable Commissioner, we have the problem with the health workforce. And in a situation in which rather than have 1 to 600 doctors, we now have 1 to 5,000 doctors in the country. It's not good enough. We are not producing enough. But even the few we are producing, we are losing them. They are going. And this is one aspect that the government must confront. Because when I was Nigerian Medical Association president, I discussed that BMA, British Medical Association level, that what we have is a perverse subsidy. Perverse subsidy in the sense that we, the poorer countries, we are subsidizing the richer countries. We train them, we train our people both at the general medical practice level, specialist level, only for them to leave because of two main things: not providing the appropriate remuneration, and secondly, not providing the facilities to work with. I mean, if we are budgeting 4.5% of our total budget for health, that means we are still not yet ready. And it was here in Nigeria, in Abuja Declaration of 2011, that we talk about 15%. Many countries are trying to move near that. South Africa recently was said to have put 12.5%, and we are still at 4.5%. We have not done enough, and we need to do more. We shouldn't wait for the next pandemic before we start running up and down.
Well, thank you, Prof. Let me ask Dr. Edu this question. Well, as chairman of the Commissioners for Health Forum, I want to assume that from time to time there will be peer reviews among the members. If you can hazard a guess, or if there are specifics, are there things either peculiar to certain states or certain regions that are only the health challenges that are peculiar only to those states or only to those regions? Are there things that are general that we have been getting wrong for so many years that will give us more trouble and more pressure to the fragile health system that you talked about if we do not act very quickly? If you can hazard some certain specifics, please.
Thank you very much. Basically, truly, there are things that are specific to some states, and there are things that are just general for the entire health system. So the issue of paucity of health workers is a systemic thing. So in every single state in Nigeria, there's a problem with health workers. Paucity of health workers is an issue, and that's why we determined that, or we're appealing that the federal government steps in, especially since a lot of states are handicapped, to do a particular scheme that can provide this and incentivize our health workers to continue to stay on in the country. But of course, some states have, let's say, molecular lab. In this situation, we have a pandemic, and there's a lot of talk about testing, ramming up testing. Some states have molecular lab that can test. Some states do not still have public molecular labs up till this point that can test. Of course, my state, we had a reference lab, but the NSAS protest led to the destruction of that lab. And so for the last 3 months going down the line, we have not been able to respond appropriately. We had an isolation center, 100 beds, that was destroyed. And so we've not been able to respond appropriately. There are states in Nigeria that do not have permanent isolation centers as we speak. Remember, isolation is not just about COVID. We still have Lassa fever that you need to isolate people for. We still have several other diseases that might be coming up that you need to isolate people for. So these states need to have permanent isolation centers. Indeed, every state in Nigeria. There's several other challenges that needs to be looked into. Primary health care are at different levels in different states. There's some states that have doctors working at the primary health care level, and other states that just have some just have community health workers, people who are not even very skilled working in the primary health centers. So there are a lot of issues at different levels, and the country needs to be able to look at it holistically and then context specific to see how well the federal government can come in to support states to do well. If you leave the states just to themselves, just to their funding, it's going to be almost impossible to see that big picture which we need to see. We're happy that the President Muhammadu Buhari was able to start the implementation of the Basic Healthcare Provision Fund, and the National Primary Healthcare Development Agency has been working to see that this fund goes to the various states. However, there are several bottlenecks that have not allowed states to access this fund. This fund is supposed to help them cater at the primary level for basic healthcare. Basic healthcare. Let the primary health centers become functional. Let them be able to get in drugs, consumables, other issues are still there. States are faced with drug revolving fund issues. These are still concerns that they're trying to battle and deal with. So really, we need that intervention both at the national level to cover all the states, and then state-specific issues which different states raise from time to time. Of course, drug counterfeiting is some of the issues which some states are facing that they have raised during our meetings. For instance, Anambra State have raised that issue and how they can be able to fight this. So they need the federal government to come in and work with them to be able to fight the issue of drug counterfeited and quackery in their state. So several states have different issues, and we believe that if we can catch in on this huge window of opportunity, I believe COVID came with a huge window of opportunity for the health sector in Nigeria, and if we let this opportunity pass us by and we miss it, it's going to be really, really very awful. This is a time for us to fix the healthcare system at the various level and make it more reliable, dependable for people. More importantly is the thing of state health insurance schemes. Some states have started.
We'll come back to that, Dr. Edu. Just one moment. That health insurance thing that you just mentioned, we will come back to that as part of the solutions that we'll be proposing. But going back to the challenges, Lassa fever, which you saw in the report, was what we opened with, and health specialists like you have told us that is so much more deadlier than, COVID-19. But the kind of response that we have had to Lassa fever falls way short of the kind of response that we have had as far as COVID-19 is concerned. And we know that every year, for as far back as you will probably know, we have had to contend with Lassa fever, with deaths as a result of Lassa fever over the years. What is the problem? Why are we unable to get ahead of that? Because come September, October, November, there's going to be another wave. And that has happened every year. What is the challenge? Why are we unable to get ahead of it?
So like I say again, we need to fix the system. If we fix the system will take care of whatever pandemic, epidemic, disease that will come its way. If we fix the system will take care of the diseases. Lassa fever, of course, has not had the attention which COVID-19 has had, because it's not a global issue. It's not an issue that affects most of the elites. It's not an issue that has probably this wide level of infection and, of course, fatality. The transmission level is not same and all of that. So it's for people who are exposed to the infected rats that get the Lassa fever. And so we don't see that level of attention given to it. But then I think a public health response should be a public health response, and every life should count. And so for us as a country, we should be working on fixing the health system, fixing the public health response. That way we can properly respond to Lassa fever and several other diseases. Remember, there's a lot more that are killing Nigerians, even more than COVID-19. The fatality rate for COVID-19 is quite low. We have maternal mortality that are killing women in their drones. At least in a day, we should have close to 3,000 women die from maternal mortality. And of course, the minister and the ED of the National Primary Healthcare Development Agency have said we should work towards ensuring that we can reduce this by 50%. But a lot is needed to ensure that we reduce this by 50%. So there's really a whole lot. Last year, we were faced with yellow fever that came in from just nowhere in between the whole COVID-19 pandemic, and we just had people dying in communities, and it took some time to be able to tell why 41 persons would die in a particular community at the same time. So we really need to step up our public health response, and that's the reason why we should have a molecular lab in every single state as we speak. So once we have challenges like this, you can quickly pick up samples, send them to the lab, identify what it is, do your proper contact tracing, and continue your public health response as you go on. So there are a lot of basic things, but all of this will revolve around getting the system to work, getting our fragile health system to become more responsive, more resilient, so that it can handle whatever challenge that comes its way.
Well, Professor Atoyebi, I don't know if you want to put a word into that one, because a good number of people will be wondering, why are we having this kind of challenge when, you know, we only have this kind of response because it's a pandemic? It's global. But we've been having epidemics, and it would seem like we're just letting things slide. As, you know, former NMA president, you'll probably have some insight as to why we have dropped the ball so far.
Well, thank you. It's consistent with the way we have been taking many of our issues, because we normally do a fire brigade approach to many things, because we know these things are there. The problem is with us, and we know the seasons when it comes, and we know the mode of transmission, and that what is most important is to get rid of the vector and the carrier, the rodents that transmit this Lassa fever. And we know some areas in the country where this happens persistently. We do not need, getting the cases and treating those cases are really not the problem. The problem is how to prevent such things happening at all. So we have not done enough to clear the rodents that carry this infection to human beings. And that is making sure we improve our sanitation consistently. We have been paying lip service to it. There was a time we had the National Sanitation Day. There was a time that we have some, but it's only fire brigade. When there's a problem, we do it. Once that problem appears to go down, we leave it alone. So there must be consistent approach to eradicating the source of infection.
But how significant is funding in this challenge? Prof, I saw something in the National Health Policy of 2016 that says, and I quote, "There are currently no clearly defined roles and responsibilities with regard to the provision and financing of health among the 3 tiers of government." It's in Chapter 2, situational analysis of the National Health Policy 2016. What does this mean? And how significant is this in the challenge you're talking about?
Yes, it's significant in the sense that almost everything that we talk about, because the power lies in the center, the federal government. Most of the local government are almost non-functioning at all. And that is actually the level where this thing could be contained effectively. They are poorly funded, and the fund that are the little that is available in many of the local government, for we know, very little attention is paid to health services. But there are many places where the environmental sanitation aspect, because really, health is a multi-dimensional issue. And definitely, if the local government and the state government are able to do more than what they are doing about these health services, putting more funds to it. In fact, if you see many of the local government areas, they hardly put any money for health services. Everybody is depending on the federal government, and that should not be so. We know that some important high-stake thing must be done by the federal government, but not only the federal government. The state government, it's unfortunate, the situation we even have with having doctors in the country. In the past, almost all state governments have facilities for even training house officers. Most of these state governments don't even have specialist hospitals, they don't have comprehensive health centers. So funding is important in the sense that funding for healthcare itself and funding for other things that affect health services. Because if they don't provide fund for water supply, fund for environmental sanitation, our health services cannot cope with all the things we have to contend with.
Teju, some of the measures that the government took to see how they could address funding and healthcare provision, there was the Basic Healthcare Provision Fund and then the health insurance scheme. For the Basic Healthcare Fund, for instance, at some point, the government did bring out this 55.1 billion from CRF to the Basket Fund. Bill and Melinda Gates Foundation did contribute global financing facilities. So are those measures themselves, what kind of impact are they having to ensure health insurance for the people? At least it's up to scratch.
Health insurance. But let me start with the Basic Healthcare Fund.
Prof, that's Dr. Edu to respond, please.
Okay, thank you for that question. Really, I think we are in a situation where we must understand clearly that the health system cannot thrive if it's not properly funded. We must be able to put our monies where our issues are. And health is essential to development of any country, to development of its people. Like you have clearly stated, there is a strong reason why Nigeria must decentralize its health system, decentralize its funding system, and ensure that more funds go to the grassroots from the local government to the state government, and then, of course, the federal government, so that people can intervene at different levels and build a stronger health system. You have mentioned some very important source of funding. The first one which you mentioned was the Basic Healthcare Provision Fund. It was passed into law in 2014 by the former president, and of course implementation started by President Muhammadu Buhari, which was great to ensure that at least 1% of the consolidated revenue is made available for basic health care for insurance in the country. However, most states are yet to assess this fund due to some bottlenecks which states are struggling with. And the truth is, if all the states can assess the fund, we can take up the bottlenecks, maybe capacity training and all of those bottlenecks that have so far hindered states from assessing this fund, then we'll begin to see the big clearer picture. The truth of the matter is that at this point in time, really, Nigeria should not be having a voluntary health insurance. No. we should have a mandatory health insurance functional in Nigeria, both at the federal level, the NHIS, and then of course at the state level, the SHIS. It's very, very important. Imagine if every single Nigerian, let's say, even if we have 200 million persons pay 100 naira for healthcare every single month, how much that would amount to. And of course, with the insurance, we can cover for the vulnerable, cover for pregnant women, cover for children under 5, and provide health care at free healthcare at the point of using that healthcare. 70% of healthcare is from out of pocket, and it has led to catastrophic health expenditure, impoverishment of Nigerians, and several other issues. But if we can provide for this health insurance and ensure that states get started, every single state gets launched, and they are on the national dashboard. And indeed, even with a presidential order or the legislative to come in and support, we can get the health insurance to be mandatory for all Nigerians. We would see a lot of progress in our health financing, and most of these tooting issues, even issues around building the health system, will be clearly addressed.
All right, Dr. Edu, just hang on a minute. We'll let you continue in just a moment while we return. Do stay with us. Welcome back to Sunrise Daily. Dr. Edu, could you go ahead and conclude your thought, please?
Okay. So basically, I was also trying to mention other sources of funding for the health sector apart from the health insurance and the basic health care provision fund. We have the Save 1 Million Lives that should be closing out anytime soon. And we are also calling on the World Bank and indeed the Federal Ministry of Health to see how those fundings can be released to states as soon as possible to help them build a system that would more probably respond to issues as they arise. Other sources, of course, our partners have been very, very helpful. Development partners across borders done a lot to see the Nigerian health system can improve, but we want them to be more strategic, work with states based on state-specific needs to see how you can provide solutions to all of these issues. However, we don't want Nigeria or states at the federal, state, or local government level to rely on partner funding or donor funding. We should begin to move towards a point of self-reliance in our health system. Finally, it would be very, very important for Nigeria to make deliberate steps to reduce out-of-pocket expenditure by whatever means that we can. We've mentioned several means. We should deliberately work at it. The federal government should assist states to work at this, and of course, the local government, from the legislation to the implementation level, all of this should happen as soon as possible.
All right, Professor Toebi, you are equally going to respond to the question of funding and health insurance in the country. If you can hear me. You may need to unmute yourself. You might have forgotten.
Yeah.
Go ahead.
Sorry for that. Yes. Universal health coverage cannot be achieved without strengthening our national health insurance scheme. What we have now is a health insurance scheme that covers less than 10% of the population. So if you are saying something should be universal, then it has to be to cover almost 100% of the people. And the reason is that only those in paid employment. We have not strengthened the community health insurance scheme. Only those working for government, either state or federal government, are covered. And not even all of these people are covered. The moment we continue with the huge out-of-pocket expenses that people use for health, we cannot get our health system to function normally. Now, most of our teaching hospitals deal with their patients on a cash and carry basis. You come, you have to pay money from your pocket to even register, and everything you want to buy is only in times of emergencies that people may be giving a waiver to start with, but you still have to pay from your pocket. This is not, I mean, it's well known all over the world that the only way to ensure that people are covered is to have health insurance. And it cannot be a voluntary health insurance. It must be mandatory. Every company, every organization must make sure that the workers are covered. And now we must go to those people who are not in paid employment, those who are in the marketplaces, those who are self-employed. It must be important. It must be one of those things you must show evidence that you are covered. Because out-of-pocket expenses is not the way to, I mean, worldwide, we know that it's done, and we cannot be an exception. We have been battling with this thing. Indeed, the Nigerian Medical Association, since 1961, produced a booklet on national health insurance. And the Nigerian Medical Association has been pursuing it until when it was flagged up in 2006. Now, 14 years after, what is the coverage we have? It is a very important aspect, hoping that when people will voluntarily go for health insurance, it's not the way to do it. It must be mandatory. And this is one thing that I believe will help people. Because the time when somebody falls ill is not the time he's going to have a lot of money. Because that illness might have been there for some time, limiting his capacity to make more money. So why do you suddenly in the middle of the night expect someone to have cash at hand to pay for his treatment? So it is quite important that the community, the one that we cover all the tradesmen, all those other people who are not in government or in big organizations, that they are covered. That is the only time we can get that. But the other thing I wanted to mention was about the basic healthcare fund provision, which is a consumer matter. And you mentioned, I had it mentioned on this program earlier, that they released 55 billion at a time. This did not track down to the primary healthcare level where they are supposed to get to. It didn't go down. And apart from the fact that many of these did not track down to the local government level, the thing has even been reduced. The amount provided for this 2021 budget is even less. I think that's about around 35 billion compared to 55, which was when it started in 2018. The law was passed in 2014, but the implementation started in 2018. And till now, it's not going down. And yet, the one provided have not been released to track down to the level where they are most important. This is an aspect where we have to make sure that we don't just make policies, we make sure that they are fully implemented. It is important. And also about healthcare, health manpower, which I wanted to mention before. Many of the doctors, when they complete their training, they need to go for housemanship. The problem also is funding, because many of the teaching hospitals and the general hospitals don't take all the house officers that they're entitled to take because of funding. And I know that the Federal Executive Council passed a policy that it will be centrally coordinated. So many of these states that are not training house officers can train. It's supposed to be centrally coordinated by the Medical and Dental Council, so that these doctors, after they have been trained, we just go to the states, and you never know when they go to a place and they like the environment, they may not even be in a hurry to go back to the cities where they are trained. So nothing has been done about that. I didn't see it specially budgeted for in this 2021. So when is it going to be implemented?
All right. So, well, Prof, there are so many issues to look at, on this matter, of health, because without a healthy human development without a healthy human capital in the country, I wonder how we can attain the kind of development that we want in the country. But let me take this to Dr. Betta Edu. We are talking about the vaccines for COVID-19 already. And as you would know, one of the major challenges a good number of people have cited about that is the capacity of the states, or capacity within the states for storage. What's the plan? The papers tell us that the hope is that before the end of this month, the vaccines will be in the country. What's the conversation among the states who are, well, of course, the health ministries, who are likely to be at the front of this? What's the plan, especially for the storage, the dispensing, and all of that?
Basically, it's good news. It's big news that Nigeria would be getting in vaccines into the country probably by the end of January. And of course, we had the Minister for Health say that we'll need close to 500 billion to be able to bring these vaccines into the country. But really, I would want to put up a very special appeal at this point in time based on the reality on ground. If we take, for instance, one of the vaccines that have been approved by WHO, which is the Pfizer BioNTech, it should be stored at minus 80 degrees centigrade to minus 60 degrees centigrade. Nigeria, indeed, most states in Nigeria, most local government areas in Nigeria, most wards in Nigeria do not have the cold chain system to be able to store vaccines at that level. We're still grappling with vaccines that should be stored at minus 8 degrees centigrade to minus 2 degrees centigrade. I think half of this money should actually be put into fixing the system to be able to collect or receive these vaccines in a potent form, and then, of course, maintain it through a proper cold chain system to the point where it's delivered in a potent form to the end user. If not, we'll spend so much money bringing in a vaccine, and then at the end of the day, we'll have a lot of wastage due to inability of the system to be able to manage these vaccines all the way down. I would strongly believe that if we invest more in the cold chain system, in cold chain movement, the logistics system, the logistics and supply chain movement, it would be very beneficial to these vaccines that should be coming into Nigeria. Each primary health care center, each secondary facility, every state should have their solar refrigerators. They should be able to have their cold chain system and their cold chain storage at local government level, the ward level, and of course down to facilities where these vaccines would be delivered to the key population that will be requiring the vaccines almost immediately. And part of that money, like you heard the former NMA the president say very clearly, that more monies need to be put into the primary healthcare sector to be able to build it. That's the foundation of the health system. And so if primary healthcare centers all across the country are not functional, I know a lot of work has been done by the present ED, but more still needs to be done. So we need to pump in more money into basic healthcare provision fund, remove all the bottlenecks, and ensure that this money gets down to the primary healthcare facilities almost immediately. And of course, for the secondary, even while we trust in the states to be able to fix these secondary facilities, there should be some assistance, because right now, as it is for states, most states are even unable to pay basic salaries, not to talk of paying health workers special incentives or improving the infrastructure around their health centers. Some special intervention funds can be made available just to assist states at this point in time. And of course, each state in Nigeria at this point in time, like I've said, should have a specialist hospital, should have one that comes with a permanent isolation center and a public molecular lab. I'm sure if we have all of this in place, if we bring in the COVID vaccine, it will have a smooth sail right from the point.
Just a moment. I thought the Ministry of Health, while they appeared before the Senate, did tell them that we actually do have cold chains in different geographical zones in the country. And as a matter of fact, that we are fresh from vaccination for polio, and so that shouldn't be a challenge. That's not the same thing you're saying, is it?
Okay, so like I very clearly stated before, a lot of primary health centers in Nigeria do not have a functional cold chain system. Some wards, some local governments across the country do not have functional cold chain system. At least in my state, I can attest to some wards and some local governments that do not have a proper cold chain storage. Remember, we're dealing with a different type of vaccine here. With the polio vaccine, which we just finished, it's a -8 to -2 degrees centigrade, and the polio vaccine is fine, and it goes in a potent form to the end user. Most other vaccines are within that range. But this is a peculiar situation where we have vaccines that require -80 to -60. That means the power supply to these cold stores and these cold houses across the country must be top-notch. Of course, you already know, it's not news, the issues we have around power in Nigeria and what should be done to help. Of course, this is not only at the state government level. Most state governments have cold chain stores that should be able to manage this. But when we step out of the state capital and we're going down to local governments, we're going down to wards, we're going down to primary healthcare facilities, we're going down to general hospitals, how many of them are able to get this cold chain system that will sustain these vaccines in potent form at -80 to -60? This is aside other issues which we have to deal with bringing in the vaccines. A lot of work has to be done on risk communication, rumor management, and all of it. If we are struggling with just convincing the public to take even polio and several other vaccines, how much more the COVID that comes with a lot of conspiracy theory and issues around it. So at this point, we should be working with communities to see how they can understand the benefits of the COVID-19 vaccines, which we want to invest in.
Right.
And of course, beyond even that, we need to work very hard on the health workers to have that understanding, preach it to their clients as they come forward, reach out to them and see that they come for the second dose. Remember, the first dose does not offer you the 95% immunity. We have about 50% in the first dose, and we have to now work on the person coming back for the second dose. You can have a lot of people drop out at that point. So there's a lot of work that really needs to be done by the committee that has been set up by the Federal Minister for Health. I believe and I hope that that committee will work with commissioners for health across the country to see that they produce results.
And those are areas that the country will keep focusing on to ensure that we address those concerns 2021 and moving forward. So, Prof, could you just give us your concluding thoughts as you wrap this up?
Well, thank you very much. I pray that the government will pay more emphasis on improving our health system, because as we have seen, that we have a fragile health system that cannot withstand any type of pandemic that we had recently. So I pray that the people in authority will make sure that even the little amount budgeted actually are released and that they are spent for the purposes for which they are meant, because we have not provided enough fund in our budget for health system to get better than what we have now, because we have seen that it's not good enough. We need better infrastructure, and we need government to actually support the private sector, the private healthcare giver, because that was done in India. And that is why people are going to India we now have these people going abroad for treatment, and we are complaining of this. The government in India supported the private sector, make sure that most of their people who are abroad with the highly skilled one came back home, and they set up private practice. Most of those Apollo and other hospitals we're talking about in India are actually private concerns.
I'm afraid we need to wrap up at this point. Thank you very much indeed, Professor Oluwole Atuyebi, former president, Nigeria Medical Association, and the former provost, College of Medicine, University of Lagos, as well as Dr. Betta Idu, Commissioner for Health, Cross River State, and the chairman, Commissioners for Health Forum. Thank you for joining us as well today.
You're welcome.
Okay, so now the president delivered a speech on New Year's Day. That's where many are looking to see Well, we'll look at that speech and setting the agenda for 2021. So predicating on that speech, how much can we achieve? Does that speech give a lot of people a lot of confidence? Where should we be going from that speech? That is what is coming up next. And we've got Muazu Magiji, former member of APC's Presidential Campaign Council, joining us from our studios in Kano, as well as Richard Wanko is the president, founder, Crusade for Justice and Human Rights Advocacy Group. So those are the issues, the people who will join us in a moment. Don't go away.